people should not be living in tunnels, in washes, and on the street.
It's just not going to happen right away. I share people's frustrations. I'm committed to trying to help, but you don't expect miracles.
A crisis in Southern Nevada. Homelessness is an issue that you can see everywhere you look.
Again, I can't stress enough that the number of affordable units in Las Vegas is so low, or they're top 3 in the country of the least amount of affordable units that the population of Las Vegas can afford.
A multi-layered problem that requires multi-layered solutions. Residents calling for immediate action.
They break into our condos all the time. We had 4 break-ins last week alone.
Tonight, we sit down with advocates, local leaders, and someone who once lived on the streets to identify the challenges and the steps that need to be taken. This is a News 3 special town hall addressing homelessness. We've been shedding light on the homeless crisis here in Southern Nevada, and tonight, a News 3 town hall on the topic. Our conversation starts with George Petty with the nonprofit Shine a Light. Homelessness in Las Vegas, George, an issue that is just so personal for you. Can you please share us your story of what led to you living on the streets of Las Vegas at one point?
Yeah, so, well, first of all, thank you for having me. And yeah, I worked 13 years on the Strip here in the hospitality industry. And during that time, I had hurt my back at work. I got overprescribed medications, and then it just got worse and worse, and progressively just kind of went spiraled out of control to the point where you know, I lost my job. I ended up losing our house, and you know, my wife went to go live with her parents. She took our young son at the time, and for me, I decided I would go on to be homeless because at the time the substances they outweighed anything else more in my life. So
the pain was so great then.
Yeah, and so it started staying with family members, and then living in the park, and then behind the Home Depot in a wash, and then I eventually went underground to live in the tunnels. And I did. I was homeless for about three and a half years, and I lived underground for about a year of that.
At what point did you go, this is not working for me anymore?
I think every day. It was just so hard to get out of that situation. The turning point for me to get help was I got arrested. I did 45 days in Clark County Detention Center. And during that time, I went in February 14th of 2020. During that time, COVID happened. The world got shut down. And so when I get out, downtown's a ghost town. There's nobody outside. Everybody's scared in their house. And through God's grace, I got in touch with the outreach director of the Shine a Light Foundation at the time, and he connected me into treatment for my substance use issues. And from there, before we had a formalized program, I walked through every phase of the program. I did some job training, I secured employment, I ended up getting a bank account, got my ID back, a driver's license, and just little by little I started rebuilding my life and reconnecting with my wife and my son. And I kind of knew it was the work that I wanted to do, was helping people.
And so a 180, because now you're with Shine a Light once again.
Yeah, so I serve as the program director today. I got my start in behavioral health as a behavioral health technician, worked up to case manager. By the time I left that place, I was the court liaison, so I worked with the specialty courts, and then came on to the Shine a Light Foundation as the first paid employee.
Wow, thank you so much for sharing your story and everything that you went through. And as you mentioned, a reunion with your family. In fact, you have a baby girl, just turned a year old. Wow.
Yes, my daughter Olivia just turned a year on the 1st, and she just got her shots this morning. So me and my wife have a pretty cool video. The needle was like this big, and I prints, but yeah.
So you're an example of that change is possible. And sometimes we look at the issue of homelessness and we think it's so desperate and how can we solve this problem, but you're saying it is possible. Yes,
absolutely.
Your teams go out there on the streets. Do you think that Las Vegas's homelessness issue is unique?
I think it's unique in the sense of the dichotomy from the Strip to, you know, people paying sometimes hundreds of thousands of dollars, and right below it, there's a population of individuals that are living without nothing, right, that are homeless, and throughout the whole valley. So with the dichotomy, yes, but nationwide, I think everybody's kind of seeing some of the same issues with homelessness.
Such a stark contrast. But I want to get to the numbers of who is considered to be part of the homeless population. The last census count found almost 8,000 people living on the streets in Las Vegas on one January night. What do your team see when you go out there and you do your outreach?
So we see a lot of adult males. We see a lot of substance use issues. That's the driver for us. Our program is based around that. So any individual that's dealing with substance use and is experiencing homelessness, we walk them through our iPath program, which is about 18 months long. We just had a graduation 2 weeks ago. We completed 65 individuals that graduated our program, and they go through all sorts of different phases. They vital document retrieval, primary care, dental, vision, and some of the same things that I talked about, going through financial literacy classes, obtaining a bank account, securing employment, doing some sort of job training. So we just want to walk them through all of that, and there's a lot of that out there when we're doing our outreach. We're seeing a lot of substance use issues,
and lots of help to get them moved on from that. So thank you, George, for setting the scene. We'll take a break here and have others in the nonprofit space join us, and also those who can change policy. Our special taking a closer look at homelessness here in Southern Nevada returns right after this.
Nobody's woken up and said, I want to be on the side of Owens Avenue just sitting around in the hot sun or the freezing cold.
I actually try to stay in garages that's in the shade where they have AC. Sometimes I stay in elevator with my dog to keep him more indoors where he's actually more cooler than out here. When I'm ready, I'll let him know.
Whenever you're ready, we're here to help you support your needs.
If you want services, if you want a place to stay, we will work with you to do that. But you just can't live out here, and that's not acceptable. In this day and age, publicly, either in the neighborhoods or on the sidewalks or in the wash, we can't allow that anymore. So you're going to have to either accept services or be willing to face the consequences.
Well, thank you for staying with us. George Petty with Shine a Light now joins our other guests to discuss homelessness here where we live. We have County Commission Chairman Tick Sagerbloom, Lou Lacey with Help of Southern Nevada, and Aaron Sheets there with Hope Link of Southern Nevada. Thanks to you all for being here to talk about this really important conversation. So before we begin, I want to take a quick survey, if you don't mind. Who believes homelessness is one of Southern Nevada's biggest challenges today? Just raise your hands. And who believes we have the capacity to solve homelessness here? Okay, so mixed responses there. We'll get into that. But first, let's start with you, Chairman. We saw the beginning of a multi-million-dollar project with the storm drains, keeping encampments away from homes and businesses who say that they're being negatively impacted here. Can you give us an update on where that project stands, what those neighbors and businesses are telling you?
Well, as we anticipated, when we started cleaning out the wash, the homeless came out into the neighborhoods, into the businesses, and so there's been an ongoing problem. We've reached out with Lewis and his team. We also have Metro there, so we're trying to deal with it. But honestly, people have to go somewhere, and if it's not jail, then they're going to be out there somewhere. So it's been a mixed blessing, but I think we've been able to address most of the issues, at least so far.
Yeah, Lou, you mentioned earlier that some of the people who live there in those encampments, they were able to connect with resources.
Yeah, when we had the teams go out immediately as soon as the construction started, we began engaging individuals as they were being displaced from their tunnels or encampments. We knew of 7 individuals that immediately accepted services, and one individual went to detox, which was awesome, and another individual we were able to emergency lodge as she had employment, and as of the time of this interview, she's doing really well.
Wow.
So, yeah.
Okay, I mean, that's incredible that you were able to make some of those connections. I hear the needs of a community, right? The neighbors and businesses who say, we need this. And then I hear the needs of those who are living on the streets also saying, well, we need a place to go. You can all chime in. how do we find that balance?
You house people.
Yes, we do. So we need more inventory. We need more funding to actually provide assistance. Our city, our county, spends about $783 per capita through nonprofits like HELP, Shine a Light, and HopeLink towards this problem. Other like communities spend a tremendous amount more. There was a study done by our friends at Nevada Grant Lab that showed like cities are spending between 500% and 700% more on this. So we need to get more funding into the space of nonprofits that we can actually deal with this in a more positive manner.
That lack of funding, is that why you didn't raise your hand when I said, do you think that we can solve homelessness here in Southern Nevada?
That was one of the big reasons.
Yeah.
I mean, it's not that we can't, it's just that we're not close to it yet. It's been a problem that has been exacerbated and gotten worse and worse over time, and it's going to take us a good amount of time to climb out of it, and it needs participation from all levels. We need all of the above strategy to actually to deal with this.
I think it's not a matter of ability. I think it's a matter of will. And the thing is that we've sent a man to the moon. So we have the ability. We just need the will. And I believe that as people are seeing this issue is affecting many people, I believe, like Aaron said, that if we can get the infusion of dollars to the nonprofits and get the ability to actually house all of these individuals, that we could affect some type of positive change.
There is a project underway. It's called Campus for Hope.
Yes.
And it's going into a community, Charleston and Jones, where there is a mix of residential and a mix of business. And there's been some pushback. People have had some ideas of what it could be. And I want to read here what Campus of Hope says it will be. It'll provide housing, employment services, childcare to prevent homelessness, round-the-clock security on staff. So how can we create more of these resources and get more neighbors to buy into it?
Well, at the end of the day, it is financial. I proposed a 1/8 of a cent sales tax. It means for every $8 you spend, you would pay 1 penny, and that would generate about $100 million a year that we could use for these services. But we haven't got that passed yet by the county commission. But Campus for Hope is a great idea. I mean, it's got to take part of the problem. But it's only 800 beds. We have, I think, 4,000 beds that we're already supervising. So it's one piece of the puzzle, but there's a lot more to go on. The other thing is we have a great entry system, but we don't have any place at the end of the process where people can live. So going back to the original question, we need more permanent housing, which again we can get there, but it's not going to be cheap.
I think if you have to address a lot of the underlying issues as well, right? Like we can house people all day long, but we don't want them to return to homelessness, right? So we have to give them the tools that they need to be able to live productive lives with the case management services and different things like that, so they don't have to go back to those situations. Keep them connected through our safety net.
Who are we seeing today? Has the demographics changed?
I believe that the homeless population is getting older. And it's kind of called the silver tsunami, where we're seeing that long-term individuals that are deemed, they're called chronically homeless, they're starting to age out and become older. Also, we're seeing a lot of families that are entering into the homeless system because of the eviction crisis and a lot of folks losing their homes. And homelessness is traumatic. So when you look at families that are losing their housing, you have children that are being traumatized because they go from living in a stable environment into living in a vehicle or in a tent. And we're working at a fevered pace to get to these individuals and get them out of homelessness as quickly as possible.
And that's something, we've learned that to the extent we can address people when they're first becoming homeless or might become homeless, that's much better than trying to deal with somebody who's been homeless for several years, where they become much more intransigent. And so that's part of our process, is trying to go out there, identify people that are living in cars and things like that, and provide services right away.
And that's where your nonprofit comes to play, preventing homelessness. I want to talk about the Courtyard Homeless Resource Center that you all passed by here on 4 Master Lane. That is run by the city, and I reached out to Mayor Shelley Berkeley, who could not join us tonight. She's addressed the need for doing more on homelessness before, and in a statement she tells me that I believe our Courtyard Homeless Resource Center is a promising start, but far more needs to be done to really make a difference. All local governments, the homeless service providers, and the private sector must be involved and working together to find those solutions. When you passed by that open air shelter, what did you think?
Honestly, it's better than nothing, but it's so bare bones, and you can see all the people lined up on the street who can't even get into it. So it basically, I think it acknowledges the problem, but it doesn't really deal with the solution.
I would agree with that. I would just go back to your point on prevention. I think prevention is a huge key that we don't talk enough about. It's the least expensive intervention that we have. Think of rental assistance. I mean, our programs, for instance, the people that we serve, less than 3 months of assistance, less than $4,000, they never hit the system of homelessness services. Less than 1% of those actually fall into homelessness after we've assisted them. It's a program that works, and then when you consider the cost of doing nothing, which is, there was a study done by Clark County a few years back, $73,000 a person in emergency services, hospitals, law enforcement, prisons, 911 calls. In today's dollars, that's $93,000 a person, where we can actually keep them housed for about $4,000 on average while we're working on the affordable housing problem. We have to build, we have to deal with our homeless, and we have to actually prevent more from falling into that pot.
Big difference there in those numbers. All right, coming up, some final thoughts on how to address this issue we've been talking about, homelessness. We'll be right back. A lot of impactful voices here in this studio. Each of you have a minute now to give us your final thoughts on solving homelessness. Chairman, we'll start with you.
So in my district, homelessness is the #1 issue, both with the homeless themselves, but also the neighborhoods where they are intruded into, and kids have to walk to school. There's all kinds of issues. So it's something we need to address. I think people are willing to address it. I think they're willing to spend money, as long as they know that's what it's going to go for. So we've developed programs. We're ready to expand those programs, but we do need the financial resources. As I said, I proposed this thing where 1/8 of a cent sales tax, every $8 you spend, it'd be 1 penny. People I talk to say we would gladly do that if we knew that's what it was going to go to. But we can't continue with this situation where we just do basically whack-a-mole. We try to offer services, but we also move them. Then they go into the neighborhoods. The neighbors get upset. It's unsanitary. It's unsafe. There's lots of crime involved with it all. So we can do better.
Lou?
I would like to say that this is a problem that we can't give up on. These individuals that are homeless are somebody's father, mother, daughter, son, sister, or brother. These are human beings, and we have a moral obligation to attempt to work to end homelessness in our community, one person, one family, one youth at a time. It's our moral duty to do that.
Yeah, I concur with you, Lou. I think, you know, a good friend of ours says kindness is nobody's trigger, and I think that we need to treat the individuals that that are experiencing homelessness with kindness, and it's a long game, right? The homeless outreach teams, it's a long game. We have to go out there, we build trust, we build relationships in hopes of offering them a way out when they're ready, right? And so, I mean, I don't think that we, Shine a Light, can do it alone. We need the help of Southern Nevada's. We need the Hope Links. We need the county. We need the city. We need, we all need to work together, and that's really our model, is everybody working together to solve this problem, because we can't do it alone, right? As a community, we can, though.
Aaron?
Yeah, I agree with Lou and you that it is solvable, but it's we have to take a systemic approach. And you're right, we have to take the long view. I mean, the system needs to be reinforced with additional funding. We need mental health care. We need substance abuse care. We need additional affordable housing. We need more properties to put people. It's a big issue. Now, I do think we can get there. What we try to do every day is just to make it a little bit better, leave it a little bit better than we found it, and serve that person in front of us. But it is going to be a long slog. It is. We have to understand that. It took us a while to get where we're at. It's going to take us a while to get out, and everybody needs to be participating in this. So anything we can do to bring more federal dollars, more state dollars, more local dollars towards this program, it's a conversation we need to have with our local leaders. I agree, we can call our representatives. We need to decide what we want to fund as a community. Do we want to fund Formula One or Super Bowl or bringing sports teams here, or do we want to save some money towards the people that need to work at those events so they can remain stable? It's a conversation we need to have, and what do we value? As Toulouse said, these are people, and they need to be served.
Yeah, well, earlier I asked you all, do we believe that we have the capacity to solve homelessness? And perhaps next time we'll have more hands raised, because that could mean that we'll have more of the funding, more of the solutions that were discussed here, more of that will to make it happen. And I hope to all of you at home that maybe you can see the help, the light, and the hope all around us. So thanks to all of you for joining us, and thanks to you at home for joining us here for the special edition of News 3.